Opposition spokesperson, Dr. Luke Evans.
Thank you, Ms Faz, and it's a pleasure and an honour to serve under your stewardship, but it's even more of an honour to have been part of this debate. And can I pay particular tribute to the member for Dulwich and West Norwood? Not only was it an emotional speech, but a powerful one. And Cresta, I'm sure, is incredibly proud, but even more so, Heather would be proud, because you have really done it justice today, not only in securing this debate, but in the way in which the members managed to carry the whole room together and bring out the most salient points, because often in these debates there's a lot to cover, and I would say she's done it with aplomb. I'd like to also thank the member for Maidstone and Malling and the City of Durham for speaking up about their personal side. That's tough to do, and they're a testament to their constituents to put it on record in public the trials and tribulations they will have been through. And I think it's really important that people feel they can advocate in this space and lead by example in doing so. And that leads me on to the member for Bexley Heath and Crayford, who talked about his wife. But also I think he's a true example of how it's important to have a powerful advocate as well. Partners and families do exactly that. They advocate for their patients as they're going through that treatment. The fact that he's here doing that as well is incredibly powerful. Turning to the member for Strangford, I feel we are starting to have regular conversations on health through Westminster Hall debates after an hour and a half this morning, another hour and a half today. I think his passion for health topics is probably only superseded by the volumes in Hansard of the content he's able to put in place. But he talked about networks, and I think in terms of research, that's really, really important to make sure that you're bringing the best brains from across the area for the biggest kind of research pools that we can have. And I think that's very, very needed. The member for Horsham, I'd like to congratulate him for actually highlighting hope. The danger is we spend so much time talking about the difficulties, but actually breast cancer is a really good story over the last couple of decades of how much things have advanced and survival has advanced. And I think it's really important to make sure we point that out to people so that it's not all doom and gloom. There is fantastic survival rates for the likes of breast cancer. And he also paid tribute to Dr. Susan, and so did the member for Wokingham. I have to say, we as MPs get lobbied hugely, and to get so many MPs signed up, to take it so far, to have debates here repeatedly, sustained, month on month, year on year, is an incredible testament to the character of Dr. Susan. And the member for North Shropshire, as the Lib Dem spokesperson, has rightfully highlighted access. I think when it comes to making sure we're getting diagnosis, access is going to be key. The last government rolled out the CDCs, the Community Diagnostic Centres, almost 170 of them. I'm hoping that when it comes to the likes of breast cancer, with new MRIs and CTs more available, it allows us to be able to have better screening pathways, because often that can be one of the things that can limit a screening programme. So the fact that that access is now being widened so dramatically, and I'm pleased to see the government this morning also confirm they're continuing this. I think it's a great cross-party working, because we all know the NHS need that. A lot has been said in this debate when we turn to the matter of lobular breast cancer. But I think for me, why does it matter? Well, it matters because of the way in which it presents. And now you can take the doctor out of medicine, but you can't take the medicine out of doctors. So I'm going to use this opportunity to make sure that people are aware they should regularly check their breasts. They should look for lumps, but they should also look for those skin changes, or what we call peu d'orange. It almost looks like a little orange peel on the breast. Those slight changes, a little bit of discharge, a little bit of blood. Now, lumps and bumps and discharge do not mean you have cancer. It simply means you need to be assessed. And one of the great things about the setup we have in this country is it's very, very accessible and very quick. This is a good success story. But we need to make sure people feel comfortable and able to do so. And what was highlighted is the cases when clinicians didn't seem to be trusting women. And I think it's really important for the clinicians listening to trust those instincts. If women know their own breasts and they're aware of the changes, you must take that seriously. And we have the chance in this, the clinical pathways to be able to do so. And that's really important. If we turn a little bit to, we've seen the incidents talked about it, 22 women in the UK a day are diagnosed with lobular breast cancer. The next piece of advice for anyone listening is, if you are unfortunate enough to get those diagnoses, I have had to give people those diagnoses. I would ask and encourage patients to ask, is this lobular or ductal breast cancer? That's often forgotten about, and I've never as a clinician been asked that. And I think that helps to change the narrative in the way in which the expectations of what treatments may or may not be available for you, but also that understanding, because when you speak to people who've had breast cancer, you might wonder why your treatment is different, and it's really important to educate people, not in a condescending way, but a general difference, because treatments are becoming so specialised and so nuanced that all is not going to be the same, and that can be quite disconcerting. At this point, I'd like to take the opportunity to pay tribute to those who are battling lobular cancer, the cancer survivors, and of course the campaigners from Lobular Breast Cancer UK, for their work tirelessly raising up the issue that we're talking about. Of course, the ultimate goal is to have a cure for lobular breast cancer, and advances in medical research and treatment options are moving closer towards this. In 2022, the last government invested £29 million into the Institute for Cancer Research and the Royal Marsden Biomedical Research to support their research into cancer, including lobular breast cancer. And this included a £1.3 million project to determine whether abbreviated forms of breast MRI can detect breast cancers missed in screening. This is what we're talking about, and links back to your point. If we have more MRI scanners, we might well be able to have the research to determine that we're able to pick these things up, and then the ability to deliver that. So I'm pleased the last government supported, through the NIHR Clinical Research Network, 10 further lobular breast cancer-related studies. I'm also reassured, and we've heard a lot about it, about the Lobular Moonshot project, and I'd like to pay tribute to the now ex-member for Horsham, the Right Honourable Jeremy Quinn, who did a lot to raise this particular issue up, and I'm pleased to see the new member from Horsham standing in his shoes, raising this topic up as well. It would be useful to know from the government if the £20 million for the 5-year study is being looked at. It was raised several times with the last government. Of course, an election got in the way, the powers changed hand. It'd be interesting to see if the proposals have been reviewed and whether they have merit for the government to take it forward. Further still, one of the key things that has slightly been missed here and is important is the idea of guidelines. And the Lobular Breast Cancer UK will be launching a campaign to call for the National Breast Cancer Guidelines in the UK to be updated to recognise lobular breast cancer. So will the Minister commit to reviewing and updating the guidelines with NICE, but also we heard it about devolved powers as well. Signed guidelines are in Scotland, and it would be useful to understand whether the Minister will be raising this across with the devolved nations to make sure we have a joined up approach so that we don't get any cross-boundary difficulties. And finally, I don't want to turn this into a debate on a political battle, because this isn't the place, so I gently ask the Minister in this area. We heard a lot about the need for support, and a lot of the support is done by charities. Now, the changes in the national, the NICs, the National Insurance Contributions for Employers, has hit charities. The likes of breast cancer, Stop Breast Cancer Now, Macmillan and Marie Curie are just a few examples, and they're not shielded from those rises. So I'd be grateful if the Minister would consider raising this up with the charity, with the Treasury, over what may be done to be able to help support those crucial nurses' advice guidelines and workers there to make sure that when people are going through these difficulties, we've seen how complex a scene it can be, particularly in breast cancer, that advice is able and accessible for all. In summary, I'd like to thank all those who took part and simply remind people that regularly examine your breasts. If you spot a change, seek help. If you do receive a diagnosis, ask if it's lobular or ductal. And finally, just remember, you're not alone. We've heard today many people suffer. There is support out there. The NHS is there for you. The charities are there for you. Your family and friends are there for you. So don't fear that. Make sure you speak out and get that support.
Thank you.